So I just wanted to send an FYI to all my parents out there that if you have a child who is not yet of speaking age, if they're a delayed speaker, if they are nonverbal, and you're seeing behaviors with them, new behaviors, old behaviors, but things like throwing their plate of food, head banging, head smacking, aggressive behaviors, just like any kind of behaviors that kind of catch your eye, rule out anything medical before you just automatically think that it's like a disruptive behavior or it's kind of a behavior that they're doing to be defiant. I work with a lot of clients who parents will say, they're head hitting. We want them to stop head hitting, put in an intervention. But the reality of it is they have a headache and they can't tell you that. I have a lot of clients who parents will say they're refusing all food, like we need to put in a food program now. And I say, well, wait a second, have you been to the dentist? Because a lot of times they're favoring one side of their mouth, they're only eating soft foods, let's break it down, let's figure out what's going on. They might have tooth pain, but they can't tell us that. So just make sure that if you are seeing behaviors that are popping up that are new, try to break down that behavior. Where is it coming from? Are you seeing any patterns with it? And make an appointment with their dentist, their doctor, their neurologist. If you have a group of providers that you see, if anything, just send an email and be like, are you concerned about this? Do you think this could be causing this behavior? We always want to rule out anything medical before we put in an intervention to change behavior. Just an FYI.